trying every diet in the book? Hitting the gym every day, yet still not seeing the results you want? For some people, there are underlying causes they aren't aware of. Today, you'll learn about the 4 most frequent health issues which can slow down your weight loss journey without even knowing you have them. It's always a good idea to get an overall checkup from your doctor prior to beginning a weight loss program because there are a few health conditions that might slow your progress. If you don't, you might miss out on some simple action steps you can take to get your body in the best place to drop weight as quickly and safely as possible. The 4 top health conditions that could potentially slow your weight loss include thyroid dysfunction like hypothyroid or Hashimoto's, type 2 diabetes and insulin resistance, certain medications to treat specific health conditions, and a poor mindset. We will discuss each health condition separately to get a better understanding of what these conditions impact, how you can prevent them, and how you can eventually, potentially cure them. Let's start with your thyroid. So your thyroid is a master gland that sits low in your neck. This gland is responsible for the metabolism of every cell in your body. Low-functioning thyroid or hypothyroidism is underreported. Only 5% of the general population has a diagnosis of hypothyroidism, but levothyroxine, also known as Synthroid, that medication, the treatment for hypothyroidism, is the most prescribed drug for chronic disease in the entire US. A slow-functioning thyroid can lower your calorie needs on a daily basis and may contribute to weight gain and difficulty with weight loss. However, I do want you to know that rates of hypothyroidism have not changed over the last 40 years according to a large-scale population study, while rates of obesity and diabetes have skyrocketed. If thyroid function were the cause, we would see a different relationship. So while it's not likely the cause, it can contribute to challenges in weight loss. So do work with your doctor to thoroughly evaluate and treat your thyroid as necessary. But I want to make sure that you ask for a full lab panel from your doctor. This isn't meant to be medical advice. Please do whatever your doctor prescribes, but I do think that you should ask if you're looking to get your thyroid tested for these tests: TSH, total T3 and T4, free T3 and T4, reverse T3, TPO, and anti-thyroglobulin antibodies. Now let's dive into type 2 diabetes and insulin resistance. Obesity and diabetes have increased in prevalence together over the last 40 years like crazy. Not only is there a strong association between the two, but I believe a causal relationship too. We find that the underlying cause for obesity is often the same underlying cause of type 2 diabetes. Production and metabolism of the hormone insulin, which is secreted by your pancreas, is responsible for carbohydrate metabolism and many other functions in the body, and it becomes dysfunctional, resulting in insulin resistance, which causes both type 2 diabetes and obesity. Fortunately, reversing diabetes is possible, but many doctors have not accepted this well-documented reality and don't treat patients with that in mind. At PhD, we're able to put type 2 diabetes into remission with the majority of individuals, and it happens quickly. Most people experience reversal of their type 2 diabetes within 6 to 12 weeks. Now, everybody is different, but if you are struggling with type 2 diabetes and you're ready to get it put into remission, then reach out to us and schedule a consultation with one of our nutritionists, and we'll talk about how we can create a plan that will put your type 2 diabetes into remission. If you're struggling with type 1 diabetes, we still can help you reduce your insulin needs and reduce inflammation so that your body can feel its very best. The traditional medical model encourages diabetics and pre-diabetics to consume too many carbohydrates and then provides medications to support their dysfunctional metabolism and inappropriate diet. Unfortunately, the medication need will only continue to increase, and eventually insulin injections are required. Reducing the insulin is key to both weight loss and reversal of diabetes. The only way to do that is through a comprehensive nutrition approach. And remember here, I'm talking about type 2 diabetes, not type 1, although I believe in a different approach than conventional treatment to type 1 diabetes as well. Now let's dive into medications and how they can impact or potentially slow your weight loss journey. Our medical system relies heavily on medications to treat patients. I could talk about this a lot and disagree that medication should be the fundamental approach to your health. A recent article came out suggesting that we treat obesity in children with medications and surgery. I'm sorry, but this is a bogus treatment plan for our kids and makes me so sad and so frustrated. However, with that being said, some medications are necessary, and it's important that we look at their role in obesity. Several classes of drugs can have an impact on weight gain. The most important I want you to know about are the diabetes drugs, including insulin, beta blockers for high blood pressure, SSRIs and SNRIs for depression and other psychiatric disorders, and even birth control. We talked about insulin with diabetes and how lowering insulin is the key to not only reversing diabetes, but for weight loss success as well. Insulin, as a hormone, not only helps to metabolize carbs, but also communicates with fat cells and tells them not to burn fat for fuel. If insulin levels are high, you can't burn fat. We always see clients reduce their insulin needs when working with us, and for most clients, this happens so quickly. In most cases, like I said earlier, we can reverse type 2 diabetes altogether so that they can get off of insulin and not deal with these negative ramifications anymore. Antidepressants in the SSRI and SNRI category are associated with weight gain. This has been shown study after study. These drugs may be required for your care, so I am not telling you to stop taking them. But if you're not sure if you actually need them and you're struggling with weight, ask your doctor. Drugs for hypertension, especially the class beta blockers, are strongly associated with weight gain, fatigue, and reduced activity. Similar to antidepressants, treating high blood pressure is important, and I'm not telling you to stop taking your drugs. However, as you lose weight, you may find that you don't need those blood pressure medications anymore. There are also other options that don't cause weight gain that you could talk to your doctor about. We also, in 98% of cases, see high blood pressure reduce and resolve quickly with dropping weight with PhD. I want to tell you a story about Phil. So Phil came in and only needed to drop about 30 pounds, and he was also on high blood pressure medication. I asked if he was looking forward to potentially letting go of that medication, and he said, "No way, no how are you going to get me off of those meds because I've been on them forever." And I said, well, there is a really high potential that you won't need those medications anymore. Now, some people do, but again, it's a high potential that he wouldn't need it anymore. And he said, okay, well, Dr. Ashley, if you help me drop the 30 pounds, which is more than I can imagine anyway, and have the benefit of getting off of those medications, I'm gonna walk up and down this busy street outside of your office with a sign on my body. And so I said it was a deal. And I'm happy to say that 10 weeks later, he was 30 pounds down and off of his blood pressure medication. However, he has yet to walk up and down the storefront wearing our PhD sign, but I'm still holding him to it. All right, so the last medication we'll talk about is birth control. And this is a very common drug and is taken by many women who may not even consider it a drug. Oral birth control in particular can cause weight gain because of the changes that occur with your hormones. Remember that the synthetic hormone in birth control is a foreign substance to your body, and women can have strange side effects as a result. The good news is that with weight loss, you may not need any of these medications. We see diabetes reversal and patients letting go of their medications every day at PhD. Birth control, now that is a choice you will have to make on your own. Weight loss won't keep you from getting pregnant and actually will make it much more likely. I have a client, Sarah, and she was actually referred into PhD because she wanted to have success with in vitro. She was struggling with fertility and getting pregnant, and the doctor sent her in to get her BMI to a healthy level so that she would be a great candidate for in vitro. When I saw her, her baby boy that she had through successful in vitro was 3 months old, and she was back in to drop weight a little bit more to get her BMI to the next level so that she could have her second baby. Remember to work with your medical team when considering stopping or changing any of your medications. The last condition that we'll talk about today is a poor mindset. It is the #1 reason why I see weight loss stall. If you are stuck in fear, or if you're telling yourself a story that does not serve you, maybe filled with excuses and procrastinations, then your weight loss will stall. What's wrong is always available, but so is what's right. You've got to change your story to change your life. I have a client, Debbie, and she had over 100 pounds to drop. She was about 50 pounds down, and a lot of people at that time could become unmotivated and not inspired to continue. But she had a great story and an amazing mindset, which allowed her to drop the remaining 50 pounds and achieve her goal. She came in to see me at the 50-pound mark, and she said, "Dr. Ashley, I feel like a sparkler. I'm so grateful for this opportunity, and I just want to send love and gratitude out to everyone I'm near, just like a sparkler does." And I truly believe that that's why Debbie saw such great and speedy success. To get rid of a poor mindset and be more like Debbie, I want you to practice gratitude. Every day, list out 3 things you're grateful for and focus on those every time old stories cycle back up. I want you to create a new identity of yourself. How would this person think? How would they feel? What would they do? Live within that identity now. Do not wait. Set an alarm for yourself 4 times a day and check in with how you're living within that identity. I also want you to get curious with yourself. Ask yourself, is this story really true? Most of the time it isn't, and you have the power to change it. The impact of these health issues on losing weight is bigger than you may expect, but they aren't impossible to overcome. Diabetes, for example, might slow your weight loss journey down a little bit, especially if you don't have a great nutritionally sound meal plan. But in this other video I recorded for you, I dive deeper into the details about the advantages of losing weight when you have diabetes and how you can even cure it. Do you want to do it yourself? Then click on the video.